Hello, my name is Natalie Sweet, and I am a historian and the program coordinator with the Abraham Lincoln Library Museum in Harrogate, Tennessee.
Hi, and I am Jake Quinn, the Director of Interpretation at the National Museum of Civil War Medicine in Frederick, Maryland, and speaking to you today from the Clara Barton Missing Soldiers Office Museum in Washington, D.C.
How cool. I'm unfortunately speaking from my home, as I'm sure many of you are quarantined right now. Jake and I had a conversation last week talking about how fun it might be if our two museums got together and asked questions that were relevant to both the past and today. So today I'm going to be asking Jake some questions related to Civil War medicine, and we'll also be thinking about some of the ways that it can help us think about and maybe confront our own moment in history. So, Jake, it's good to have you here, and it's good that we're still able to chat and collaborate with each other during this time.
Yeah, this is great. It's amazing to have all of this technology available that we can all chat and we can, get together with friends and family that we can't see in person and even have class and educate and continue on with this crazy world that we're now experiencing.
Now, something that Abraham Lincoln could have definitely appreciated and would have liked to have used during the Civil War a lot faster than the telegraph.
Probably.
Yeah, so we'll kick this off, and I'll ask you, what were some of the differences between the ways people understood and treated disease during the Civil War and the ways that we understand and treat diseases today?
Yeah, so one of the big focuses for the National Museum of Civil War Medicine is to talk about what the realities of medical care were like during the 19th century, and there's something that's associated a lot with myth. There's so many myths about Civil War medical care, and one of the biggest is that they were in the Dark Ages, and that's just not true. There's a lot of medical knowledge that had begun accruing in the early 19th century that is available to doctors by the time that the Civil War breaks out. The heroic age of medicine, this is the idea of doing bleedings and that sort of thing. The four humors in the body that maintain health and wellness. Those are starting to go away. The idea of doing things like bleedings, thankfully for the Civil War soldiers, but we're not quite yet to the point of scientific medicine that's going to develop later in the 19th century. So the Civil War takes place at this time where medicine's in a real transition moment. And there's lots of different competing ideas and theories. One of the most important of the time theories of medicine, and specifically about disease, is focused on air, and bad air. And so that's you see these treatments that are going to come around with the focus of this. So the idea that disease is spread through bad smells, through sewage, through corpses of both animals and of humans, and so the focus on getting rid of that bad air is the emphasis for treating disease. So this is where you see in Civil War hospitals that they all have lots of windows. You want fresh air because they believe that that is key to getting rid of these outbreaks of disease. It is understood at the time that disease can be spread from person to person, and so doing things like quarantine is something that is seen during the war, as well as in cases of isolation, when you have a severe outbreak of things like gangrene, they understand that isolating patients and removing them from the general population is going to be better for other patients. But unfortunately, they do lack a lot of the knowledge that we have today. So they don't understand exactly what the connections are between things like dysentery, diarrhea, typhoid, and sanitation and nutrition. They don't understand those connections. They don't understand infection. They don't understand how infection works. They don't understand about disinfecting things. There's a theory that is begun at the end of the Civil War by doctors in Europe that are going to start disinfecting their surgical tools, but that's not around at the time of the Civil War. So the big difference is that they don't really understand how infection and disease functions, and that's the big difference between then and now in terms of disease.
That's one interesting thing that we look at with our museum too. We focus largely on the life of Abraham Lincoln and such. So even though we talk about the Civil War as a bigger event, uh, and look at that as an issue in it, we also take a very careful look at how disease and death and the aid of doctors affected the Lincoln family themselves. And as you know, in 1862, the Lincoln family faced a terrible moment when their middle son, William Lincoln, died in the White House, and both he and Tad had been ill. So it's interesting to see that Abraham Lincoln went out and actually got one of the medical nurses to come and help assist with the Lincoln family. But we see a lot of the same things that you describe, the knowledge that doctors and nurses had at that time period. And we see it too with the Lincoln assassination. So an interesting thing with the Lincoln assassination is that the very first doctor who arrives at Lincoln's side is actually a young man who has just graduated from what will eventually, as history progresses, become NYU. But he was about very young. He just graduated from college, and his thesis had actually been on brain injury and head injuries, and he had focused on trephining. And so reading through his thesis or dissertation as such for when he graduated is interesting to look at, because we see that he's not this there's a common people image I think people have of, you know, these doctors sometimes just being these butchers that just hack and go at limbs and stuff and don't really understand what they're doing. But this was a young man who had studied the techniques of what was coming out of Europe and was interested in that. And he was very intelligent. It comes through in his account of how he treated Lincoln after the assassination. But it does offer a big contrast to the popular conception of what people thought people in the Civil War know as indifference to what they actually knew. So it's somewhere in between, I think, what the reality and public perception is.
Absolutely. These doctors, many of them, and there's definitely some, you have to be, honest, like there's many of them that are quacks, that don't know what they're doing. Most doctors in America before the Civil War had never seen a gunshot wound before, let alone to see 10,000 of them in a single day. So people are overwhelmed by the scale of what they're facing. There are a lot of doctors who are not up to the challenge, but there are many of them who step up, who learn. And at the end of the Civil War, American surgeons, American doctors are going to be some of the best in the world just because they have so much practical experience with dealing with disease, dealing with wounds. And you start to see the rise of specialization as a result of the Civil War. So you see people focusing on things like brain injuries. Neurology comes out of the Civil War. Some of the first studies on that and looking at things like phantom limbs. So you see with amputees who lost an arm or a leg during the war and still being able to feel that limb even though it's gone. You see that during the war that medicine becomes much more scientific, becomes much more evidence-based, and that influences medical care for the decades that follow, and you can directly draw that line up to the present day, the connections between how medicine changes during the Civil War and how it's impacting us.
That's so interesting. Uh, Going back to the Lincoln family too, with us, we see that even the first family of the United States that at that time was not unaffected by disease. We see the death of a child. Later on, we see actually Lincoln become quite sick around the time that he gave his famous Gettysburg Address. So with that in mind, which diseases were most common during the Civil War? And as a follow-up too, which were the most deadly?
Yeah, so most common disease of the Civil War is going to be dysentery and diarrhea. Many causes of that, oftentimes connected to the poor nutrition, poor sanitation in camps. And so diarrhea and dysentery is the most common ailment that you're going to see amongst Civil War soldiers. That also spreads to civilian communities as well. Another of the common common disease that you see in these army camps is typhoid fever. Typhoid fever is what is believed Willie Lincoln is going to succumb to in 1862. There's an outbreak of typhoid fever in the city of Washington that winter of 61 to 62. Soldiers out in the army camps all around Washington are suffering from it, not just in Union lines, but also on the Confederate side, down around the Manassas, Virginia area, also suffering from typhoid fever. And that was spread through contaminated water. And there are simply too many men with too few facilities, not enough infrastructure to deal with all of these hundreds of thousands of men living in close quarters, relying on the same water sources where their sewage is ending up. The conditions in the first winter of the war were horrific, and typhoid fever is going to be a major problem throughout the Civil War, because in many of the places that these soldiers are going to camp, where they're going to fight, there is not infrastructure to deal with all of those men having to use facilities, to go to the bathroom. Their latrines just simply can't handle it. By far the most feared disease of the war is smallpox. That is the one that is most feared. It is also one that is more understood than many of the other diseases that are going to be dealt with during the war. Because they understood smallpox could be spread from person to person. They also understood that you could be vaccinated against that. Going back to Washington's day, going back to the 18th century in America, vaccination against smallpox becomes, I won't say common, but it is practiced. And so during the Civil War, you see that. In some cases that goes wrong. There's research out there that shows that soldiers trying to self-vaccinate themselves against smallpox ended up giving themselves syphilis because they were all sharing the same tools in order to do that. So that was definitely the most feared. And if it would spread, you see that happening in army camps. They will quarantine troops. But where smallpox becomes most dangerous are in the refugee camps of the war. Where there's not a lot of the infrastructure, medical infrastructure there, the doctors there to assist, the knowledge wasn't there to know, to give those folks, the care that they needed, also to understand what was actually happening with the illness. Just to list off one more that doctors could do something about, is malaria. Malaria did affect soldiers on both sides during the conflict, civilian populations as well. And they had found by this time that quinine was quite effective, both preventative and in treatment of cases of malaria. So there's another disease that they could do something about. Those first two that I mentioned, diarrhea and dysentery, there's not much that these doctors could do. For the diarrhea, they're giving these guys opium, try to bind them up a little bit. And in other cases with typhoid fever, many cases in typhoid fever, they're giving mercury. The idea being still holding on from that heroic age of medicine, that whatever is giving that patient that fever, we need to flush it out of their system by making them vomit, by making them have even worse diarrhea than they might have already been experiencing. And oftentimes, in those cases, mercury does prove to be quite poisonous, and in many cases actually kills the patient as opposed to treating the illness.
So we know all these interesting things today. We mentioned that civilians could be affected just as much as the soldiers themselves. Was it something that we learned as historians later on, that this was being passed between civilian and soldier populations, or were they realizing that at the time of the Civil War too? Were they making connections between these outbreaks?
Yeah, they definitely understood that there was a connection, and they understood in many cases that unhealthy conditions were responsible for it, but there's simply not the ability to deal with those conditions under the nature of a war, that they can't really deal with these situations because of the nature of the conflict, because we need to have all these men in a small, relatively small space in order to defend the national capital, for the Confederates to have their lines of defense in Northern Virginia. And then that is going to spread to the rest of the conflict as well. I'm here focused in the so-called Eastern theater of the war, but this is the same kind of conditions that are going to be faced throughout the war zone, whether out in the West, down in the Deep South. These kinds of conditions are going to be faced by all armies. And then, like I said, between the civilian populations as well, because they're living in such close quarters in many cases.
Mhm. Right. And I'm going to ask another question too, related to this. You also mentioned refugee camps that had outbreaks of disease. Were they more forgiving of when disease broke out and there were soldier groups nearby and public opinion? Or what happened if disease broke out in a refugee camp? Did it have the possibility that it would cause the local population to be resentful towards those camps?
Absolutely, and I'll throw the credit out to a great book on this topic by historian Jim Downs, Sick from Freedom, that talks in depth about these issues. Absolutely, there was resentment against those camps before there were outbreaks of disease. You know, large populations of slaves who are escaping and who are emancipating themselves with their feet, going into Union lines, seeking protection. They're going to be ultimately put into relatively small spaces. This part of the country in the DC area had quite a large number of refugee camps established both in Northern Virginia and here in the District of Columbia. And disease outbreaks inevitably happened. You put lots of people in a small space with poor quarters and poor sanitation, with a lack of medical infrastructure there in terms of hospitals, in terms of doctors, and inevitably disease is going to break out. And we see that this isn't just in the 19th century. We see this today. This is an issue that, you know, currently right now in places like Syria, where you have large places of displaced populations with little medical infrastructure available, a disease outbreak can be catastrophic. And it was during the Civil War. And unfortunately, we still haven't progressed that far 155 years later. We're still dealing with these same things. And like today, there was a lot of resentment against those populations. Here in the United States during the Civil War, you do see that when these outbreaks start, that resentment is going to be heightened against those populations that are perceived to have been bringing diseases that are unique to those populations into areas that may not have had them before. And in some cases, that's true. In some cases, disease outbreaks, because of these populations being treated as they were and isolated and into these small pockets, when that disease ultimately spreads from those camps and out into the general community, people got really upset. But ultimately, you need to take care of those people in those populations and make sure that because they are most at risk, they need that medical treatment. In some cases, you see that during the war, and in most cases, you don't. And we have a hospital here in DC, which is kind of a more positive example of a place called Camp Barker, which was a refugee camp for freed slaves, for slaves here in the District of Columbia, that ends up having its own hospital established called Contraband Hospital. It becomes Freedmen's Hospital after the war, and that actually becomes the Howard Medical School hospital after the Civil War is over. So you see there, in some cases, rare cases, you do see the treatment that is going to be more satisfactory to the conditions that are faced in those camps. But in many cases, especially out in the Western theater of the war, you don't see that as often.
Now, authorities today are recommending that people practice social distancing and quarantining themselves during this pandemic. And you mentioned that quarantine was known and used during the Civil War. So my question to you is, how exactly was isolation and quarantine used? What did that look like? What were the specifics of it?
Yeah, so a specific example, many of our Civil War interested listeners and viewers are probably going to be pretty familiar with the movie Gettysburg. And in the movie Gettysburg, we see a big focus on Joshua Lawrence Chamberlain and the 20th Maine. What they don't really talk about in that, because it's focused on Gettysburg, is that in the previous campaign, in the Battle of Chancellorsville, the 20th Maine were actually they were isolated. They were quarantined because in the spring of 1863, that regiment was being inoculated against smallpox. And somehow during that inoculation phase, one of the patients ended up getting a full-blown case of smallpox, which quickly spread through the regiment. And within a matter of days, they had 90 cases of smallpox within the regiment. This is on the eve of the Chancellorsville campaign, so Army leadership made the decision to not take the 20th Maine into battle with the rest of the army for fear of spreading the disease to the rest of the army. And so they were taken to a spot near Fredericksburg, Virginia, called Quarantine Hill, and they were posted there, set up camp. They set up hospital facilities for the sick soldiers, and then they posted signs all around that said, "Warning, danger, smallpox," and the regiment was stuck there for a couple of weeks and missed out on the Battle of Chancellorsville. So that's one example. I also love that, Joshua Lawrence Chamberlain, at the end of, while the Battle of Chancellorsville is raging, he pleads with a higher officer and says, well, at least let us go out there. We can at least give the Confederates smallpox, which, I think is a funny line. But the truth of the matter was, smallpox was, like I said earlier, very feared by these armies because it could spread like wildfire if allowed into the general population. So that's one example. And they did that in other cases during the war of separating off these units and isolating them. Another example is with the treatment of in hospitals of what became known as hospital gangrene. And hospital gangrene, it's still questioned about what exactly it was, likely a staph infection, very virulent staph infection that would spread quickly from patient to patient in these general hospital wards. And so what would happen, they understood that this was being spread seemingly either through the air or from patient to patient. And so what they ended up doing is isolating those patients who ended up with this hospital gangrene into separate wards, and putting them into wards that were specifically geared towards hospital gangrene to prevent its spread to the rest of the hospital population. So that's another example that you see that they did understand that there was distancing played a part, and separating those who are sick from the general population in order to try to prevent spreads of these contagious diseases and infections from the rest of the army, the rest of the hospital.
Okay, so we see quarantining is removing and putting people in another location to be isolated away from the general public. But what about people who were already isolated in a small contained space? So today we saw a lot of concern in the past week because inmates at Rikers Island in New York had been found to have the coronavirus. And so there was general concern about what that meant. And there had been calls from some of the public, too, that for nonviolent offenders, they needed to be released from local prisons. What are people basing that knowledge on? What role did disease play in the mortality rate of Civil War prisons?
Well, that is the place where disease is most rampant and kills at the highest percentages, because those are populations you look at, and this is for northern prisons as well as southern prisons. You have lots of people in a contained space, and they did not let them out when these diseases start spreading. And what that ends up with are death tolls in the thousands amongst camps of tens of thousands. These are deaths in percentages that are just astonishing. Places like Andersonville are going to get the biggest, rap sheet, because not only do you have the poor conditions and poor nutrition, but you also have some cruelty exhibited towards prisoners. But in northern prison camps, the death rates are similar, just based on the diseases that are spread through these camps and through these populations. That in many cases, some of them were probably brought along with the prisoners when they came into the camps to start with, because you see that being communicated amongst these armies. But also some of the diseases are connected to the conditions in those camps as well, and the poor nutrition, the malnutrition of the prisoners there, making them more vulnerable to those diseases, more susceptible to getting them, more susceptible to dying of them. And the medical facilities in those camps were just not up to the standard that was needed to save those men's lives. And what you end up with are death tolls that are astonishingly high, mass graves, just conditions that are absolutely appalling.
Yeah, it's definitely something that we see today, that there's been a lot of controversy surrounding the roles and responsibilities of individual leaders in the coronavirus outbreak, whether it be from the people in charge of making decisions about these prisons, to mayors, to, of course, the President of the United States. And being at the Abraham Lincoln Library and Museum, we talk a lot about the criticism that Lincoln faced during his presidency. So, can you speak something to how the public perceived and reacted to Lincoln's dealing with outbreaks or disease, or even Jefferson Davis's hand? Did people look to their presidents to take an active hand in dealing with medical issues like these?
Yeah, it's not so much around disease, not so much around disease, but definitely around the competency of the medical departments within the Army. And this is an area that Lincoln specifically is going to feel some pressure through the war, especially in the early stages of the conflict. The United States Army's medical department was just not up to the challenge of what it was going to face. Part of it is because they, many in government, many within the Army, anticipate this to be a short conflict. They're not going to ramp up and mobilize the medical department in a way to that ultimately was going to be needed in this huge conflict, because they thought that the war was going to be over in 90 days. And so at the early stage of the war, the medical department, which going back into the pre-war antebellum time period, the medical department was known for an area that cut corners and saved money for the Army. They stripped the budget bare of the medical department simply because the Army wasn't very large, 15 to 16,000 men before the Civil War broke out. There was not a lot of need for medical infrastructure. Before the war, U.S. Army has one hospital, and it's out in Fort Leavenworth, Kansas, with 40 beds. That's it. In terms of hospital facilities for permanent hospital facilities for soldiers of the U.S. Army. And so as the war goes on and the conflict escalates, the medical department of the United States Army is constantly behind what the conflict is escalating towards. And so they're playing catch up. And for the first year of the war, it is a disaster. The first Battle of Bull Run, men are left on the battlefield. No one comes to care for them. No one comes to get them. They're left out there to be exposed to the elements, July heat, or to get picked up by Confederates and taken back to Richmond. And that doesn't really change for the entirety of the first year of the war. So by 1862, this becomes a public crisis because there is no confidence in the medical department. That means that if a soldier's out there on the battlefield, they're not anticipating if they get shot, if they get wounded, that if there's no one coming to get them, how keen are they to go in with, to go in and do their duty in battle if they don't feel that anyone is responsible for caring that for them once they're injured. And so that translates to the home front as well. And what those people on the home front are fearing, what is going to happen to their soldiers at the front lines if the medical department is so incompetent. And so you start to see by the second year of the war, decisions are going to be made that are going to try to reform the medical department of the Union Army. And you see the appointment of William Hammond as Surgeon General of the U.S. Army, a young doctor in his mid-30s who is keen on reform. He's going to put Jonathan Letterman in charge of the medical department for the Army of the Potomac, the main army in this theater of the war. And together, those two officers, as well as many of the other young reformers in the medical department, are going to take charge, and they're going to completely overhaul the Union Army's medical department in order to save lives on the battlefield, make battlefield medicine more efficient. And ultimately, by the end of the conflict, the medical department is going to get has pretty good opinion numbers. And that is going to reflect well on the Lincoln administration in terms of caring for these soldiers when it comes to the medical department itself. As for the Confederate side, Jefferson Davis and the Confederate government, they have the challenge of creating a medical department out of nothing. And so I think that their population, the Confederate population, is a little more forgiving in terms of the medical care that's going to be given. And some evidence to suggest too that there's not a real big focus on the medical department in terms of, they're not going to have the same level of organization that the Union government will have when it comes to the medical department. They also don't have access to the same resources that the federal government has and is bringing into this conflict. So they're playing their own game of catch up, relying on many cases on what they can steal from the Union government, from the Union Army, on campaigns, medical supplies that they need desperately, like opium, for example. But yeah, there's definitely, there is definitely a major pull of public opinion around health issues during the war. It's just not necessarily the same health issues as we see applying public pressure today. Then it's much more on battlefield medicine, much more on the care given in the hospitals as well, and making sure that the facilities are in decent shape, and less on the spread of disease, spread of infection, that sort of thing.
All right. Well, this has been a fascinating talk, Jake. I know that I've certainly learned some new things, and I look at items related to the Civil War and read about the Civil War every day. So thank you for taking time out of your day to answer some of our questions.
Absolutely. This has been great. I look forward to doing this again. And yeah, this has been a fantastic conversation.
Absolutely. And we hope that when we have that next conversation, that everyone out there will join us again as we dive into questions about the Civil War. Thanks for joining us.